Hey everyone, this is Dr. John Burroughs in Colorado Springs. I'm an oculofacial plastic surgeon. Here I'm going to show a filler rhinoplasty using Restylane Lift. This is an off-label use for fillers, but it's something we commonly use. Now, in my opinion, the only safe way to do this is to use a 22 gauge cannula, which is not sharp, as smaller cannulas act just like needles, and needles carry a high risk, especially in the nose, of blocking a blood vessel because the needle can penetrate into the vein or artery, which can then occlude the vessel that could cause the skin in the area to die and scar. It can also, these needles and the smaller cannulas, under very rare circumstances, embolize through the vessels to the eye and even cause blindness. Now, I've already used the needle that allows the entry of the cannula into the area you need to inject. And right here, we're injecting the tip to help it project better, as it was starting to protrude inferiorly and the patient did not want this appearance. You always want to have plenty of hyaluronidase enzyme available so that in the event of an emergency where you start to get a vessel occlusion, you can inject the area and flood it with the enzyme. Here at Springs Aesthetics, we keep always between 5 and 6 full bottles of the hyaluronidase in the unlikely event that we would need that. So usually for a nose, I only come from below and then one side above, but this patient had particular asymmetry concerns as well as a prominent dorsal ridge, so she required more sites of injection than typical. I think any filler that's injected acts like an implant, and serious infections can occur. So we prep the skin with Hibiclens, which kills bacteria on the surface within seconds. That in preparation of the skin was not shown in this video. Now, we are using Restylane Lift for this case. It has a good G-prime or stiffness to it that lasts well in the nose. I've had most patients have at least 9 months of improvement and some up to a year. I want to note on the cannula where that red colored cap is, just below the white portion of the syringe, is an orientation for where the port on the cannula starts to inject. Now, during the injections, you do sometimes need to massage and see how things are going by both appearance and palpation. Here's an area on her lateral aspect of her left side of her nose that needed filling to improve the symmetry. You can also improve the appearance of a wide or sweeping nose by injecting and creating more of a dorsal ridge. Here's a before and after showing that symmetry and a dorsal ridge improvement, particularly near her tip. It was improved. Here's a smoothing of that dorsal ridge. Here's another case where this patient had a very broad nose that swept, which you'll see in a moment. And after her injection, you can see on the right, smoother and less broad appearing nose. Here on the oblique view, you can see the improvement of that sweeping she had of her nose. And then you can see it again on this sagittal view. She was very happy with this result. And then you can see on this young lady also improvement of her dorsal ridge and obtaining a more straight appearing nose. Well, I hope this was helpful. And again, I recommend 22 gauge cannulas for the maximal safety. Call if you have any questions. Thank you.